Hello everyone. Today we will discuss one of the important high-yield topic for the NEET PG pharmacology, and that is Hartford Nomogram. Hartford Nomogram is a clinical scale and that is used for extended or once a daily dosing intervals for aminoglycoside, for example for tobramycin as well as for gentamicin. So for tobramycin and gentamicin, you can use this Hartford nomogram to decide the dosing interval after the aminoglycoside is administered for the first time. Now let us discuss why do we need extended interval dosing. Aminoglycoside, they are having concentration dependent killing. Here in this graph, you can see the antibiotic concentration which can have antibacterial effect, and if it falls below the MIC, that is minimum inhibitory concentration, then also it can exert its post antibiotic effect. Instead of giving small doses, you can give larger doses at an extended interval for aminoglycoside, and that is known as once a daily or extended interval dosing. Higher peak concentration produces greater bacterial killing effect, and we have already discussed that aminoglycoside is having a post antibiotic effect. So even though the concentration falls below the level of MIC, it will continue to exert its killing effect on the bacteria, and that is known as post-antibiotic effect. Now this is the Hartford gentamicin nomogram. This nomogram will act as a guide when to give a patient the next dose based on the gentamicin concentration and the time the measurement was taken. So here in this nomogram, you can see on x-axis the hours after the dose of the blood sample was taken, and on y-axis you can see the gentamicin concentration in milligram per liter. So this you can see it is being divided in three zones. Now if the gentamicin concentration is in this zone, for example in the 24 hours of zone, then you have to give gentamicin 24 hourly. If concentration of the gentamicin falls in this gray area, then you have to give gentamicin 36 hourly, and if it falls in this dark gray area, then you have to give gentamicin every 48 hourly. The blood sample of the gentamicin that you must take between the 6 hours to 14 hours of the last dose injection of the gentamicin. So if the concentration of the gentamicin is above this line of 48 hours, then you need pharmacokinetic dosing regimen which is individualized for that particular patient. Now let us discuss when the Hartford nomogram is not indicated. In the pediatric patients, you cannot use this. Pregnancy, severe burns, ascites, patients with the abnormal renal function, in all this condition, Hartford nomogram is not indicated. Now let us discuss one MCQ. A 65-year-old man with the gram-negative septicemia is started on gentamicin 7 mg per kg IV once daily. A serum gentamicin concentration measured 10 hours after the infusion plots below the 24-hour line on Hartford nomogram. What is the most appropriate dosing interval? 12 hourly, 24 hour, 36 hour and 48 hours. Here you can see it is in this area. So the answer here is every 24 hours. Another MCQ. A 70-year-old patient receives 7 mg per kg gentamicin. A serum drug level is obtained 8 hours after the administration. Which variables are plotted on the Hartford nomogram? Dose versus body weight, serum concentration versus time after the dose, creatinine clearance versus dose, peak concentration versus trough concentration. So the correct answer here is a serum concentration versus time after dose that we have already seen in the Hartford nomogram. So let us revise about the Hartford nomogram. So you have to plot this Hartford nomogram at least 6 to 14 hours after the dose of gentamicin or tobramycin is administered. H stands for Hartford, A stands for it is for aminoglycoside, and which aminoglycoside? Gentamicin and tobramycin. Then random serum level that is plotted on the y-axis, time after the dose that is usually plotted on the x-axis. So T stands for time after dose, and F stands for find the extended dosing interval that is at the 24 hourly, 36 hourly or 48 hourly. You have to decide the dose So Hartford Nomogram helps you to decide the dosing interval rather than the dose itself. So important concept in the exam that you have to remember is that Hartford Nomogram will not help you to decide the dose, but it will help you to decide the dosing interval, which is known as once a daily or extended dosing interval. So this was about the Hartford Nomogram, which is commonly used in the aminoglycoside. If you like this video, then subscribe to my channel and follow for more such pharmacology related videos. Thank you.